Hello, everyone. Today, we're diving into a complex yet essential topic of managed healthcare. We'll explore the ethical and legal challenges that professionals in this field must navigate, especially when considering the balance between patients' care, cost, organizational pressures. I'm excited to discuss this out with you today. Enjoy! My name is Arnisha Shigad, University of Phoenix. I want to start by emphasizing how important it is to think of managed healthcare as delicate as balancing act. Managed healthcare, a personal perspective on coordinated care. Managed healthcare is like having a support system that helps navigate medical needs while keeping costs in check. Instead of figuring everything out alone, patients have access to a network of doctors and specialists who collaborate to provide the best possible care. Whether it's through an HMO that requires referrals for specialists or a PPO that offers more flexibility, the goal is to ensure quality treatment while managing expenses, according to Centers for Medicare and Medicaid Services 2023. From a personal standpoint, managed healthcare can feel both reassuring and restrictive. On one hand, having a structured system that means that medical decisions are guided by professionals who prioritize preventative care cost efficiency. On the other hand, needing approvals for certain treatments or being limited to specific providers can sometimes feel very frustrating. However, these safeguards are in place to prevent unnecessary procedures and keep healthcare costs from skyrocketing, according to KFF 2022. Ultimately, managed healthcare is about finding a balance, getting the right care at the right time without breaking the bank. Key players in managed healthcare: insurance companies, healthcare providers, doctors, hospitals, patients, and regulatory bodies. If you ever dealt with doctors, insurance companies, or frustrating back and forth of getting the care you need, you know that managed healthcare isn't always simple. It's a system where different players, insurance companies, doctors, and hospitals, patients like us, and the regulatories have their own priorities. Sometimes it feels like the healthcare system is more about money and policies than the actual care. But at the heart of it all, people just want to be healthy and treated fairly. So it's important to talk about ethical and the legal side of healthcare because when one part of the system fails, real people like you and I, we suffer. How managed healthcare works. Network-based healthcare, focus on preventative care, coordinated patient care, and utilization management for cost control. One thing that stands out about managed healthcare is its focus on prevention. The goal is to avoid expensive treatments down the line, which is philosophy I've come to really appreciate in healthcare. It's like prepare for a rainy day before it starts raining. Legal and ethical challenges. In this graph, Professor Fenner explains the Health Insurance Probability Accountability Act (HIPAA) of 1996 was established to protect patient privacy, ensure insurance probability, and improve administrative efficiency in healthcare. HIPAA is divided into five titles. Title 1, Preventing Discrimination in Insurance Coverage. Title 2, Enforcing Privacy and Security Standards for Health Data. These regulations are critical in protecting patient rights, but also present legal and ethical challenges. From a personal perspective on this graph, HIPAA plays a crucial role in safeguarding patient confidentiality, but it also highlights ethical dilemmas such as balancing cost-saving measures with patient care, insurance limitations, and end-of-life decisions. While healthcare providers are legally obligated to uphold privacy and security, ethical concerns arise when financial constraints influence medical decisions. Additionally, denial of care due to insurance restrictions remains a significant issue, often conflicting with patient right to essential medical services. Furthermore, end of life care presents difficult ethical choices where patient autonomy and medical interventions must be carefully balanced. These challenges demonstrate the complex intersection of legal requirements, financial limitations, and ethical responsibility in healthcare. Ultimately, while HIPAA provides a strong framework for patient protection, as you can see, ongoing ethical discussions are necessary to ensure equitable healthcare access is for all. HIPAA and its impact. When I think of HIPAA, I'm reminded of how much trust we place in healthcare providers to protect sensitive information. It's a reminder of how delicate privacy really is. Have you, have any of you ever wondered how much of your own personal data is out there and what measures are taken to keep it safe? So in this slide, it just talks about HIPAA and its impact, protecting patients' data privacy, electronic record security, and ensuring access to only authorized personnel. ACA, Affordable Care Act, and Managed Healthcare, expanding healthcare access, regulations on insurers, focusing on patient rights. ACA changed the healthcare landscape, but it also presented new challenges. I've personally seen its impact making healthcare more accessible, but it hasn't come without growing pains. The Affordable Care Act (ACA) significantly altered the healthcare system by expanding access, increasing regulations on insurers, and strengthening patient rights. Expanding healthcare access, one of the most impactful aspects of ACA, has been the expansion of healthcare access. Millions of previously uninsured Americans gained coverage through Medicaid expansion and the creation of healthcare insurance marketplace, according to Rosenbaum 2021. Personally, I've seen how this policy has helped individuals who otherwise would have gone without necessary medical care. However, this expansion also brought concerns about affordability and provider availability, leading to longer wait times, strain on some healthcare systems. Regulations on insurers. The ACA implemented a strict regulation on insurance companies such as permitting denial coverage based on pre-existing conditions and mandating essential health benefits in all plans. Blumenthal, according to Blumenthal 2020. These protections improve consumer rights, ensuring that more individuals receive necessary medical services. On the other hand, some insurance some insurances responded by increasing premiums or exiting certain markets, limiting consumer choice in some regions. Focusing on patients' rights, the ACA prioritized patient rights through measures of such as eliminating lifetime coverage caps, allowing young adults to stay in their parents' insurance plans until age 26. Summers, according to Summers 2019. These changes empowered patients and provided more financial security for families. However, the complexity of healthcare systems, of healthcare systems remains a challenge, and many individuals who struggle to navigate insurance plans and healthcare costs. Strengths of ACA and HIPAA. While we may face frustrations with regulations, these policies also protect us. ACA helps ensure we don't get left behind, and HIPAA ensures that our sensitive information stays in safe hands. I think these two things we often take for granted until they are challenged. So in this slide, it's basically going over strengths of ACA and HIPAA, and I included again patient protection enhanced, stronger data security, broader access to healthcare, and insurance regulations to ensure fairness. Challenges of ACA and HIPAA. That's me in your top left hand corner. As helpful as regulations are, I think we can all agree that costs and complexities sometimes outweigh the benefits. For small organizations, staying compliant with these regulations can feel like an uphill battle. Just question yourself. Has anyone ever experienced firsthand the difficulties these regulations impose on providers and patients? That's one of the reasons why one of the many key components is why I want to become a healthcare administrator. It's the challenges of ACA and HIPAA, the high cost, the high compliance costs of providers, complex regulations, risk of fraud, and affordability issues. So I just chose the pretty lady that there in the top left hand corner because that's going to be me in those board meetings fighting for the costs and the regulations and affordability issues of ACA and HIPAA. Organizational behavior and quality management. In my view, adopting TQM and Six Sigma and managed health and managed care could provide that perfect balance we're all striving between quality and cost. Think about how much smoother things could run if everyone on a team is striving for continuous improvement. This is all about creating culture where everyone plays a part. Quality management is essential in healthcare to provide patient outcomes, reduce errors, and increase efficiency. Two key frameworks, Total Quality Management (TQM) and Six Sigma, provide structured approaches to achieve these goals. TQM focuses on continuous improvement throughout customer focus, process optimization, and employee improvement per SPAS 2018. In healthcare, it fosters collaboration among doctors, nurses, and administrators to enhance patient care. Six Sigma, using DMAIC methodology, define, measures, analyze, improve control, emphasizes data-driven improvements to reduce errors, optimize resource allocation, and improve cost efficiency per Anatomy 2006. Both frameworks prioritize employee engagements to drive quality improvements, which leads to a better patient outcome, says SPAF 2018. By integrating these methodologies, managed care organizations can balance quality with cost, ensuring efficient processes and improve patient health care. In this slide, you'll see organization behavior quality management, TQM quality management, total quality management, Six Sigma data-driven focus performance and cost efficiency that improves employee involvement in patient-centered care. In conclusion, managed healthcare may seem like a complicated web of rules and regulations, but it's important to remember that it's all meant to create the best experience for patients. In the end, it's about understanding and improving the systems around us to make healthcare more accessible, ethical, and effective. Managed healthcare aims to balance cost and quality care. HIPAA and ACA are important legal frameworks through though they come with challenges. Organizational behavior philosophies like TQM and Six Sigma drive improvements in both patient cost and efficiency. Thank you so much for watching. My name is Arnisha from the University of Phoenix, undergrad for Business of Healthcare Administration. Thank you so much for watching again. And here is my APA references as stated through slides 1 through slides 10. Take care.